Hello, I'm Stuart Madow, Director of Professional Relations with Carolina Caring. We are here in China Grove in beautiful Rowan County with our palliative medicine clinic that we want to tell the public about what palliative medicine is, what palliative care is, what those terms mean, and what is in it for you having a palliative medicine clinic in your neighborhood. Palliative medicine essentially is a consulting service for any serious illness. It should be noted that anyone can refer themselves or anyone else to palliative medicine with consultation from your primary care physician. So let's go inside and take a look at what a palliative medicine clinic is. We're inside here at our Carolina Caring Palliative Medicine Clinic, and you might be wondering, what is palliative medicine? What is palliative care? As I had stated, it is for any serious illness, right from the diagnosis through the progression of the illness. What might be that? Perhaps COPD, lung issues, heart disease, advanced dementia, any serious illness should be considered for palliative care right from the diagnosis. You can also use palliative care while you're seeking aggressive treatment, while you're using home health. You can use palliative care, palliative medicine. We use the term palliative medicine here at Carolina Caring to show how comprehensive the service is. Now, many of you may have heard of palliative care before, palliative medicine, and heard of hospice. Most palliative care providers also do provide hospice care, as does Carolina Caring. But here at this clinic is solely focused on palliative care because this is a vastly underutilized service here in Rowan County and throughout the state of North Carolina. In healthcare, there are two elements that I always talk about. One, the quality of care, and two, the cost of care. With Carolina Caring, you're going to get very high quality care in our palliative medicine program. But let's talk about the cost, because that is a major concern for every patient and family. Palliative medicine services are covered under Medicare, Medicaid, most private insurances. Plus, Carolina Caring is a nonprofit organization. We have a foundation that raises funds for those who may not have coverage through the other elements that we talked about. Once again, Medicare, Medicaid, most private insurance. So this takes a relief off of most people. Probably will have a copay with that, just as you would with any other specialty service. But it's a relief to know that there's a very comprehensive coverage package for palliative medicine. Let's go in the clinic and we'll talk more about the care itself. We're here in one of our examination rooms here at our Carolina Caring Palliative Medicine Clinic. As you can see, it's a warm, cozy environment. We want our patients to be comfortable as they're interacting with our physician or nurse practitioner who is overseeing their care. Family members can also join in on the consultation if that's what the family and the patient would like. So I want to talk a bit about what exactly are the services that are provided with palliative medicine and why should you consider it. As I had mentioned before, when you get a diagnosis with a serious illness, you should consider right from the beginning of that diagnosis to consider palliative medicine. Perhaps you want to talk to your primary care physician and see what their thoughts are. Because we are not trying to replace any of your physicians. We are another set of eyes to overlook the overall continuum of care that you have for your condition. So, as I had stated, it's a consulting service. Visits are approximately once a month. You can have your visits in the comfort of your home or in the comfort of our palliative medicine clinic or wherever you call home, an assisted living community, a skilled nursing center, or even in the hospital. So, what will happen when you have your discussion with your provider here at Palliative Medicine Clinic? We'll discuss the illness, of course, and the disease progression. Where are we? And where are we going? And what are the goals of the patient throughout this diagnosis? We're going to discuss the patient's therapies. Symptom management is a big concern. Pain or other symptoms that you may be going through that are related to your diagnosis are a big factor of what is covered in the palliative medicine consult. We pay close attention to polypharmacy. What is that? Your medications. You may have one doctor prescribing this, another doctor prescribing that, and suddenly you find yourself with 10 or 15 prescriptions of drugs. One thing that our nurse practitioner does is look over all of the drugs that are being diagnosed, are being prescribed, and discussing with you and your other providers what is needed, what may not be needed, what maybe needs to be added on. Polypharmacy, medication reconciliation, as we call it, is a key component of every visit with your palliative medicine provider. We want to talk about comfort, support, counseling, education. These are things not only for the patient, but for the family themselves as we are going through this journey together. We are going to have assistance with advanced care planning, and that would include advanced directives. What are your advanced directives? Your living will, your healthcare power of attorney, and other documents that may help you as you plan through your diagnosis. And we want to navigate the healthcare system. There are a lot of resources out there that may be available to you in addition to our services, and we want to help you connect with those. Here at the Palliative Medicine Clinic, we have 8 offices for our palliative medicine staff to utilize, as well as the 2 examination rooms for adults, and then 1 examination room for our Cardinal Kids Pediatric Palliative Program, as well as an education area, conference room, where we will be conducting educational programs for the general public, as well as for other healthcare professionals, and for our staff for internal education as well. I'm here in the reception area at our Palliative Medicine Clinic in China Grove in Rowan County to talk to you about who's on your team, your palliative medicine team. Well, first you have your outreach person, that's me. Tells you about what palliative medicine is, educates the public, educates other professionals. Then you have registered nurses. These are the people who will make initial home visits and initial assessments of your condition. They'll review your medications, they'll complete an initial assessment of the patient. They are also available to you between visits. So if you have a question between one of your visits to your second visit or your next visit that's scheduled, you can call our office and discuss your situation with your registered nurse. You may need to bump up your visit, have a visit more quickly than what was scheduled. We offer you a lot of flexibility. Visits in your home or wherever you call home, or a scheduled visit here at the clinic. Then of course you have your physician and your nurse practitioner. These are going to be your main providers who are working with you to provide treatment, make recommendations, adjust and prescribe medications, with the goal of keeping you out of the hospital. We don't want to have you flying back and forth to the emergency room. We want to keep you safe at home in the environment that you are most comfortable in. Also wanted to talk about our Cardinal Kids program. We are one of the only providers in the greater Charlotte area who has a pediatric palliative program. And we see those patients here as well at the clinic or in their home. We have a dedicated examination room just for our Cardinal Kids Pediatric Palliative Program. We also here at the clinic in Rowan County will be offering educational courses on a variety of healthcare topics, including palliative care, including other elements of healthcare, to the general public as well as other healthcare professionals. We also want to reiterate that anyone can make a referral to palliative care. You just call our number and we will get with you the education and information you need to see if you're medically eligible for our palliative care program. And I want to point out, while we are also a hospice provider, our palliative medicine program is separate. Palliative medicine is not hospice. It is a separate program for any serious illness. We here at Carolina Caring believe we have a very robust palliative medicine program that can offer you care in your home in any of the 12 counties that we serve, or with the flexibility of coming here to the Palliative Medicine Clinic. I should also point out there are other members on your team. We have a social worker available for you. They will assist in supportive counseling and resource information. As I had mentioned earlier, there are a lot of healthcare resources in our community, and our social workers can help connect you with those. We also have chaplain support for any spiritual needs that you may have available to you in the palliative medicine program. So I want to reiterate, cost, quality of care. Remember, palliative medicine is covered under Medicare, Part B, Medicaid, most private insurances. And also, you can make a referral anytime, and you have the flexibility. Do you want the nurse practitioner or doctor coming to your home, or do you want to come to our lovely clinic here in China Grove? We actually have 7 total clinics in the service areas that we have. But we'd love to see you here, and if you have any questions about our palliative medicine program, please give us a call, and we'll be glad to answer any questions that you have. Thank you.